orthopedic surgeon at Sunshine Hospitals, and today I'll be talking about ankle sprains. This is a very, very common injury that happens to everyone, not just sports people. Definitely people who are playing badminton and basketball and football have more propensity to get an ankle sprain, but even when you're walking down the street, if you suddenly twist, it can happen. People who wear high heels, they can have ankle sprains. So it can happen to anyone. So an ankle sprain, basically, why does it happen? It happens because of a twisting injury at the ankle joint. So if you look at my ankle joint over here, so inversion or eversion. Inversion means inwards and eversion means outwards. Any of these movements can cause an injury to the joint. So the joint is this joint. This movement happens at the ankle joint. Now, if it's very severe, it can fracture the bone. The medial malleolus or the lateral malleolus can get fractured. But it's not only a fracture, but even a regular sprain where the ligaments over here get badly stretched, they are also very, very painful. Initial phase, when you have the injury, you may not know whether it's a fracture or whether it's just a sprain, because the pain is equal for both in the initial stages. The first thing you got to do is go to a hospital, get an x-ray done to rule out the presence of any fractures. Now, though fractures are way more painful, they will definitely heal within a span of 6 to 8 weeks. But ankle sprains, though less painful, they are very, very nagging, because they may last for the pain and the stretched ligament and the pain may last for many, many months to even years for some people. So you have to take care of it very, very properly. So the moment you know that you have an ankle sprain, you're going to have a swelling at the ankle joint, you're going to have lots of pain, you're going to have difficulty in moving the joint. So after the x-ray is done, once you've ruled out a fracture, what is the treatment? The first thing is you have to take some painkillers to reduce the pain and also reduce the swelling around the joint. Ice packs do help to reduce the swelling. You have to immobilize the joint. It's very important that you immobilize the joint by putting on a plaster. So initial phase, when there's a lot of swelling, we put a temporary plaster which is called a slab. We just have a plaster of Paris, we put it behind the joint and we wrap with a bandage. This is usually applied for around 5 days to 1 week. After a week, we see the patient again. We remove the slab, and once we know that the swelling has reduced, we put a permanent cast. That is, if you see the joint over here, we wrap the whole thing around. We can use either a POP or a fiber cast. Once you put this, the whole point is that the ankle joint should not move now. The ligaments which have been stretched like this, the fibers, they should have time to start healing again. What happens is, if we don't put a cast, every time the pain reduces, then the person starts walking in and then the ligaments get stretched again. So it doesn't solve our purpose. It doesn't solve our problem. This cast usually has to be kept for at least 4 weeks. After 4 weeks, once we remove the cast, we still have a little bit of pain. We can just put a regular ankle wrap around and use that for the next few weeks until the pain completely comes down. It's very important to immobilize the joint after an ankle sprain. Don't take it lightly. This has to be taken care of. A cast is always the best way to treat an ankle sprain in the long run. Thank you.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.